States in our area are learning that they may get fewer vaccine doses next week. Health officials say they're still trying to find out the root cause of the change, while the federal government maintains everything is still on track. Jess Arnold joins us now live at the Health and Human Services building with more details. Jess, what are we learning about this?
Yeah, well, as you mentioned, Leslie, Maryland and Virginia said that the federal government told them that they'll be receiving fewer vaccines in the coming weeks than they had initially planned for. Now, a spokesperson for the Department of Health and Human Services says that they had only specified allocations up to this week. So they claim that there haven't been changes per se. They say that each week will bring new numbers. Now, in the meantime, Department of Health officials say that they're just focusing on getting vaccines into bodies.
1, 2, 3, little poke.
Days after celebrating moments like this throughout the country, Maryland, Virginia, and some other states received word that incoming vaccine shipments could be smaller than expected.
It's definitely frustrating, but we were working off of planning estimates, so I think we always expect change in these scenarios. But we'll look to better news in the future.
Virginia had been planning on getting 480,000 doses in total from Pfizer and Moderna this month, but Dr. Lori Forlano says the federal government told them yesterday they should expect about 100,000 fewer. The Maryland Department of Health also shared they may get fewer than their initial 155,000 Pfizer doses next week.
If there's nothing we've learned in the last 9 months, is that a lot can change in 4 weeks. So we're going to just focus on the work that we have in front of us today and make adjustments as needed.
A spokesperson for the Department of Health and Human Services says this isn't a reduction. They've only provided specific allocations for 2 weeks of Pfizer shipments and 1 of Moderna. They said they'll let states know each week what's available. But this is where it gets unclear. While the feds point toward manufacturers controlling availability, Pfizer said in a statement production is on track and they have millions more doses in their warehouse but have not received any shipment instructions for additional doses yet.
It's definitely a moving target.
With potential weekly changes, she says it's hard to estimate when they'll finish vaccinating priority groups, but they'll make sure to use every dose available. Now, the HHS says that they still are on track to vaccinate 20 million Americans by the end of the month, pending Moderna approval. Now, Dr. Forlano anticipates that approval coming in the next day or two and says that if that happens, Virginia will receive 146,000 doses from them. Now, Leslie, Dr. Forlano really wants us to remind everyone that now is not the time to let our guards down. Wear that mask, socially distance, and she says stay home until we can all have access to the vaccine. Leslie.
We all have a role to play, and you just described it for us. Thank you, Jess.